Checklist on oxygen therapy. Assess immediate respiratory status, including symmetry of the chest wall expansion, chest wall abnormalities, temporary conditions affecting ventilation, respiratory rate and depth, sputum production, and lung sounds. Decreased chest wall movement, crackles, or decreased lung sounds, increased respiratory rate, increased sputum production, or hypoxia indicate the need for non-invasive ventilation to improve oxygenation. Observe for patent airway and remove secretions by having patient cough and expectorate mucus or by suctioning. Secretions plug the airway, decreasing the amount of oxygen that is available for gas exchange in the lungs. Check the doctor's order for oxygen, noting delivery method, flow rate, and duration of oxygen therapy. This ensures safe and accurate oxygen administration. Safe oxygen delivery includes the 6 rights of medication administration. Explain the procedure to the patient and family. This increases compliance and cooperation of the patient. Choose appropriate equipment for patient-specific needs. This ensures safe and accurate oxygen administration. Check the environment for safety. Oxygen supports combustion, smoking, open flames, electrical equipment that emits sparks, synthetic fabric that builds up static electricity, and oils are not permitted around any oxygen delivery devices in the hospital. Perform hand hygiene. Reduces the transfer of microorganisms. Attach oxygen delivery device like cannula or mask to oxygen tubing. Check if there is oxygen inside the tank. Attach to humidified oxygen source or to the humidifier. Then, turn on oxygen to prescribed flow rate, then test flow. Humidity prevents drying of nasal and oral mucous membranes and airway secretions. This also ensures correct oxygen delivery. Follow procedure for the equipment you are using. Position tips of cannula properly in nares and adjust elastic band or plastic slide on cannula or face mask so that a snug, comfortable fit is achieved. This directs flow of oxygen into patient's upper respiratory tract, and patient is more likely to keep device in place if it fits comfortably. Assess patient's breathing and adjust equipment if necessary. This ensures delivery of prescribed oxygen therapy in conjunction with a specific cannula or mask. Explain safety precautions to patient and watchers. This increases compliance and cooperation of the patient and watchers to ensure safety. Observe patient's external ears, bridge of nose, nares, and nasal mucous membranes for evidence of skin breakdown. Oxygen therapy sometimes causes drying of nasal mucosa. The delivery device can cause skin breakdown where the device delivery comes in contact with the face, neck, and ears. Stay with the patient until it is safe to leave. to confirm that the patient is already safe and has stable vital signs. Post oxygen in use sign to patient's door to let the visitors and other workers in the hospital know that oxygen is used inside the room. Perform hand hygiene. It reduces the transfer of microorganisms. Evaluate the following criteria. We have oxygenation and perfusion. We can check it by getting the RR and checking the capillary refill, or check if the patient is cyanotic. Or you can use pulse oximeter to check for the oxygen saturation. Continual monitoring with pulse oximeter is required for patients on oxygen therapy. You can also evaluate by getting the ABG, or arterial blood gas. But ABG can be checked but not frequently measured as it is an invasive procedure. You can also check the mental status of the patient. Mental status, or level of consciousness, evaluates patient's response to supplemental oxygen. As patient's level improves, physical signs and symptoms improve.